Hello everyone, today we will be discussing Parkinson disease. But before going into the detail of Parkinson disease, let's have a clear concept of a two words Parkinsonism and Parkinson disease. The Parkinsonism is a clinical syndrome consists of tremor, rigidity, brady or akinesia and the postural instability. So whenever a patient presents with these four clinical features, it is called as a Parkinsonism. For this clinical feature of a Parkinsonism, there are multiple factors are responsible. The first one is drugs such as phenothiazine, butyrophenone, metoclopramide, sulpiride, cisapride, and methyl dopa. The second one is a poisoning such as a carbon monoxide, manganese, and MPTP, methyl phenyl tetrahydropyridine. The third one is a post-encephalitic. The fifth one is a herbicide. The sixth one is trauma. The seventh one is a genetic. The eighth one is a cerebral tumor. And the tenth one is a Wilson disease. So the Parkinsonism is caused by the wide variety of disease. The last one is paralysis agitans, also called as idiopathic Parkinsonism. Mean when the cause of the Parkinsonism is not known, mean that there is no secondary cause of Parkinsonism, it is called as idiopathic Parkinsonism. This idiopathic Parkinsonism is called as Parkinson disease. So in short, the Parkinsonism is a clinical feature of tremor, rigidity and bradykinesia and postural instability, while the Parkinson disease is idiopathic Parkinsonism. Now let's discuss the Parkinson disease. The Parkinson disease is a neurodegenerative disorder in which there is a loss of dopaminergic neuron in substantia nigra. In brain, the all activity are under the control of two hormones, the inhibitory hormone dopamine and the excitatory hormone acetylcholine. So in Parkinson disease, there will be a loss of dopamine producing neuron, so there will be an overactivity of an acetylcholine. Along with this, there will be also accumulation of a Lewy body. The Lewy body is a alpha synuclein and other protein inclusion in a Nigral cell. Clinically, the Parkinson disease consists of four diagnostic features. The first one is tremor, the second one is rigidity, the third one is a brady hypo or the dyskinesia, and the fourth one is a postural instability. The tremors of the Parkinson disease is a coarse tremor with the frequency of 4 to 6 Hz. It present at rest, it improve with voluntary activity and sleep, and increase with emotional instability and anxiety. Initially, the tremor is characterized by a pill rolling tremor between the thumb and index finger. Later, these tremors also affect arm, leg, feet, and jaw. You guys can see the pill rolling tremor in this video. Now come toward the second clinical feature, rigidity of a Parkinson disease. In Parkinson disease, there are two types of rigidity. The first one is a lead pipe rigidity and the second one is a cogwheel rigidity. The lead pipe rigidity is a uniform rigidity in flexor and the extensor of limb, and it is better seen in elbow and knee. And in cogwheel rigidity, it is an exaggerated stretch reflex. It is predominantly present in wrist joint. You guys can see the lead pipe rigidity and the cogwheel rigidity in this video. After rigidity, now let's discuss the third clinical feature, the dyskinesia or the hypokinesia in Parkinson disease. The dyskinesia means the difficulty in initiating a motor activity, while the bradykinesia means the slowing of the movement. So the patient of the Parkinson disease will have a difficulty in initiating a movement and will have a slow movement. So the patient will not be able to tie his shirt button, and the patient cannot perform an alternating rapid movement. You guys can see an example of dyskinesia and the bradykinesia in this video. Now come toward the last feature of Parkinson disease. It is a postural instability. The patient of the Parkinson disease will have a stooped or the flexed posture. Along with that, there will be an abnormal gait. So, what will be the gait of a patient in Parkinson disease? The patient of Parkinson disease will have a fascinating gait. Mean a patient will walk with small shuffling step. You guys can see the gait in this video.
Stooped over, leaning forward, and then we'll have difficulty as far as initiating gait. When the gait is initiated, there are small steps. Oftentimes there's a tremor associated with this. And as the gait progresses, there may be a picking up of speed, or what's called a fenestrated gait. And then in turning, instead of having the normal turning, the patient will turn en bloc, which means they'll turn almost as a statue moving around. And then again having difficulty starting in the marche petit pas.
As you have seen the gait in Parkinson disease, now let's discuss it. Imagine if a patient have to walk from point A to point B. So at point A, the patient will have a difficulty in initiating a movement. Mean the patient will show delay response to command called as a freezing. Once a patient start walking, the patient will walk with small shuffling step with a flexed posture as if the patient is catching its own center of gravity, and the patient will move with less swinging of his arm. At point B, the patient will have a difficulty in stopping. Along with that, the patient cannot turn rapidly. The patient will turn in a circular manner called as a fraction gait. So in short, the patient of Parkinson disease will have a freezing in initiating movement, walk with a fascinating step, and at end there will be a fraction gait, mean the patient cannot turn abruptly. It was all about the diagnostic clinical feature of Parkinson disease. Other than this, the patient will also have a mask-like expressionless face with less blinking and a staring look called as a serpentine stare, and there will be a blepharoconus, the tremor of eyelid. Other than this, the patient will have a positive Meyer-Sur sign. Mean when we repeatedly tap over the bridge of nose 2 per second, it will produce a sustained blinking response. It is called as a Meyer-Sur sign. It was all about the clinical feature of Parkinson disease, and the diagnosis of the Parkinson disease is usually made on a clinical ground. In the next video, we will be study the treatment of a Parkinson disease.